Namaskar, मैं Dr. Munjal Thakar, and today we are going to see one more very common difficulty during case takings. And I will have my assistant Dr. Kajal narrate what she went through during one of the experiences in her case taking.
Hello, myself Dr. Kajal Jadhav, Assistant Homeopath from Similia Classical Homeopathic Clinic. Today I am sharing my experience regarding difficulties during case taking, especially with elderly people. So एक पेशेंट था 80-year-old गाय, तो उनके साथ ड्यूरिंग केस टेकिंग जब मैं सवाल पूछ रही थी उनको, सो वाइल गिविंग आंसर टू दैट पर्टिकुलर क्वेश्चन वो यहाँ वहाँ की बातें कर रहे थे, तो उस टाइम पे मैं उनको करेक्ट नहीं कर पा रही थी. एट दैट टाइम आई फेल्ट के because of he is elder to me, I should not correct him or I should not ask him कि आप इसी चीज का आंसर दो मुझे.
So, what Dr. Kajal just now narrated is an extremely common experience, especially with homeopaths who are not really rigorously trained into studying the interaction, the unconscious interaction that is happening between you and the patient. So, in her situation, she begins to see the patient in a position of authority, in a position of someone who is like a father figure and to whom you cannot tell much. And similarly, the patient begins to see the physician, in this case Dr. Kajal, as a young, inexperienced girl. And then this unconscious dynamics that happens, instead of a physician, a healer and a healee, to a parent and a child. The child being the physician here, Dr. Kajal in this case, and the parental figure being that elderly gentleman of 80. Now, this is a very complex as well as an interesting situation. From standpoint of psychology, this is, if we look at it from Dr. Kajal's viewpoint, it is the unconscious language that the patient is radiating to you from his form is called countertransference. And you, as a physician, that you unconsciously, through your mannerisms, through your form, through your dressing up, radiating to the patient is called transference. Now, largely, this will happen and cannot be prevented completely, because there is an unconscious language or unconscious communication that is happening between you and the patient. In this case, it became a hindrance to the case taking because the case continued to go for much longer and did not yield some more fruitful data. The other side is when you get a very positive unconscious communication between you and the patient. In that case also you lose your objectivity. When you become too positive, you still lose your objectivity. When you become negative or too passive, you still lose your objectivity. You are involved, and you are involved in an unconscious game. Now, this unconscious game, for a young homeopath like her, and for many who are going to watch this video, becomes the source of awareness about our own self. And also, interestingly, this becomes a source of understanding how the patient works with you, how the patient perceives you. In this case, this man was not her father figure, in no way was her authority also. And for the patient, she was supposed to be a physician at a conscious level, but at an unconscious level, she is a young child. Now, you take this opportunity as a homeopath, as a healer, to see what is the pattern that emerges between you and patients. So for younger homeopaths, you might find that patients will treat you as a child, patients will treat you as, uh, uh, and patients who are of your own age, they will treat you as a friend. And then also things can get difficult. You lose neutrality. And when the patient also loses neutrality and stops seeing you as a healer, the kind of information that they volunteer will also get filtered. This is the negative side of the phenomena of transference and countertransference. The other side is you become aware of the unconscious patterns that are within you and within your patient. So sometimes you come and you encounter a patient who comes and treats you absolutely rudely for no reason. They will just take you for granted, or they will come and shout at you for no reason. This is also very interesting. This should give us what is the inner world of the patient. And as you grow, as you become more aware, you will learn how to respond to this instead of getting involved into this. So use these experiences between you and the patient, the experiences of the transference and the counter-transference that is happening between the two of you, as a source of awareness. At any point of time in practice, probably for me at my age, a lot of patients start seeing me as an authority figure. And that becomes a problem because they will not tell many things because you're not supposed to tell the authority. And then for me to find this out is to check with my assistant what the patient was sometimes saying, because there they reveal the truth. And even the bigger truth happens very often at the reception. And my staff will come and tell me, look, this is what he or she was saying, while in front of me, everything was just perfect. So one will need to be very aware and try and find out ways how you can see through this. So do think about this, keep pondering about this, look at your own experiences, make a mental note. If you can keep a diary, wonderful. And do subscribe to our channel, do forward my videos.